Chang has met medical staff and residents in Wuhan, the epicenter of the coronavirus outbreak. Li is now on his way to Beijing to meet the head of the World Health Organization as the number of people killed by the virus rises to 81. More than 2,700 have been infected. The Chinese government is putting aside nearly $9 billion to fight the outbreak, and it's extended the Lunar New Year holiday until next Sunday. Scott Heidler has the latest on Beijing's efforts to contain the outbreak.
And the government here, as we heard, has taken it to the top levels of government on how they're going to deal with the coronavirus situation. Actually, the premier, he's the second most powerful government official here in the country. Premier Li Keqiang is in charge now of the government's efforts to control the coronavirus situation. Now, to give you an example of how these mechanisms go into place that try to prevent the further spread of it, we're in front of a hospital here in central Beijing. There are two 20-year-olds inside, 20-something-year-olds inside, a man and a woman. They traveled up from Hubei province about 4 or 5 days ago. They've been in the hospital since. That's because when they went to a hotel, they took their temperature and it was elevated, so they've been put in here. We spoke with the woman on the telephone, and she said she's going to be in here for probably another 10 days. So it's that 14-day incubation period, sometimes can be asymptomatic, that really has raised the concern about the spread of this virus. So this gives you an idea of just how seriously and how conservatively the government is taking this situation here.
And meanwhile, leading virologists in Hong Kong are warning the outbreak is far worse than what the Chinese government has said. Let's bring in Adrian Brown joining us from Hong Kong. So what are they basing that on? And what's being done in Hong Kong, Adrian, to contain the virus?
Well, we've been hearing this afternoon from Gabriel Leung. He's a leading epidemiologist. He is he's the dean of Hong Kong University's medical faculty, and he basically says, based on computer modeling that they've been using, as other experts are around the world right now, he estimates that in fact 44,000 people have been infected by this virus in Wuhan. And he also says that the rate of infection will double every 6 to 7 days. So again, this is based on computer modeling. It doesn't mean it's necessarily going to happen, but he said it is their forecast, their sort of worst case scenario, you might say. So these are alarming words coming from Hong Kong, and they appear to, in a sense, contradict what the World Health Organization has been saying, because the World Health Organization so far hasn't felt compelled to declare an international public health alert. The experts in Hong Kong are saying that draconian measures will be needed, not just by Hong Kong's government and China's government, but by other governments around the world. In the case of Hong Kong, for instance, Hong Kong has to think about things like food imports. Everything it eats just about is imported, much of it coming from the mainland. So his message was, unless there is good planning, unless we heed the warnings, then, we could be facing a global epidemic, in his words.
And what is Hong Kong doing in terms of planning? How is it trying to contain the virus?
Well, so far, the chief executive, Carrie Lam, has said she will not be closing, even temporarily, the frontier between Hong Kong and China. She said that simply wouldn't work. It was impractical, in her words. So what is happening now is that anyone arriving in Hong Kong from Hubei province is being turned around and sent back. But of course, it also requires honesty when visitors fill in their health declaration forms at the airports or other ports of entry to Hong Kong. Honesty really is going to be the key here. But people who arrive here from Hubei are not being allowed into Hong Kong. And in neighboring Macau, they've gone a step further. There are currently about 1,100 people from Hubei province in Macau. They've been told to leave, otherwise they will be placed in quarantine.
Okay, Adrian, thank you for that update from Hong Kong. Still ahead on Al Jazeera.
And guys, honesty, the word for the day. We live in a world that's not very honest, guys. Let's tell the truth. I'm being honest. I'm just trying to throw some things at you. I think we're heading to pandemic. I'm not going to dink around. I'm not going to lie to you. I'd rather have you prepared than not. Still, food, water, gas, masks, any kind of other soaps, any other things you think you're going to need, defensive items, yes. Not yet, but down the road, if this thing goes awry, believe me, people will get very desperate. Over there, people are getting desperate. You're just not seeing it. They're controlling the media. You're only being let see what they want you to see. Just like when you go to Korea, they only show you certain things. That's the same thing going on. You heard it out of the horse's mouth now. They're saying it will double every 6 days approximately. I put to you that that's going to alternate because of when people catch the virus, that you're going to start seeing multiples at some point of this disease every other day. It's going to go boom, boom, boom. I'm not kidding you. I also want you to tune in to BP Earth Watch. If you missed one of my previously videos, go over to BP. We've got some evidence now that shows this came out of Canada, out of one of their security level 4 labs up there, and that 2 Chinese people that were working there left with it and were caught, but the product, the disease, was not recovered. So with that, you should probably check out BP Earthwatch. He's got that. That he covers so much, guys. There's so much there. You just need to watch it. On my own over here, like I said, very odd. The military. Until I start seeing military guys sick, I'm gonna go put forth that there's probably is vaccination. This goes way back. I'm gonna try to get you some dates. I'm gonna try to get an interview on the phone with that lab up there tomorrow, or the following day at the latest. With big monies, vaccinations, if they even work, we know how that all comes into the arena. But until you start seeing their own hierarchy level government people, including the emperor type situation getting sick, or the military, they've already got a vaccination, and that's the kind of people that will sacrifice their own. And there's some great evils going on, guys. If you read the Bible, you already know what's coming. I'm not saying this is exactly that one, but eventually something like that will happen, I'm sure. This is what we've all prepared for. So just stay alert, stay on top, keep your eyes and ears open, and remember, healthcare sucks. Over and out.